London Road Surgery. How can I help?
I'm in a lot of pain. It's my hip.
Hold on. You've done really well.
I hope it works after all that.
I'm not going to dumb school.
Well, because you have to go to school then.
I'm not going to stop!
Stop it.
Trying to be a carer and working in mental health NHS, it's sort of taken its toll. I can't physically or mentally do it anymore.
You need to be seen from the chest point of view to figure out what your risk is for doing this again.
Oh, yes, let's do that. It's on your head, though.
Thanks.
The symptoms that you're mentioning are in keeping with clinical depression, so we need to get you off these drugs.
What are these old scars from?
Burns.
What happened?
Fireworks.
Oh, my goodness.
Fireworks in your pockets.
OK, take a seat in the waiting room. Thank you.
Mr. Zach?
I'll come in just 1 second.
No worries.
Thank you. Oh. Oh.
Hi, morning.
Good morning.
Come in, have a seat.
I will.
If you can.
Oh, I can.
You can?
Oh, it's 9 days now.
Right.
And it's not getting any better. And today, even because I came to see you, I didn't take any painkillers.
Tell me what's the background to this.
Week ago, I wake up in the morning with a little bit of pain on my right-hand side, get difficulties to get off the bed.
OK.
Reason why I came, because, you know, I can't really sleep 3 hours a night, you know, and then, I don't know, maybe I should go for some X-ray, I don't know, I don't really know.
So, with this, you woke up at the start of this with the pain. And it's, from what you described, whereabouts is the pain?
Is around here, you know, around this area. But what's happening is, you know, when I let's say, when I standing up, you know, and I want to get straight up, the pain from the back going to the front, you know, so when I straight up like this, I can feel pain here and there, you know.
What do you do for a living?
I'm driving, you know, I'm taxi driver.
Can I examine you? If that's all right.
Yeah.
Can I get you to straighten your knee and then lift it up as high as you can?
Oh.
Now, can you tilt this foot backwards?
I can.
And is it causing
a little bit? Yes, a little bit. Yeah.
So when I push it backwards.
Oh yes.
Yes.
Yeah.
Okay. And then you can relax it back down. Fine. Okay. This leg, can you lift it up?
Oh my God. Yeah.
That aggravates it as well.
Yeah.
Okay.
I was trying. Oh no, I can't go any further. Oh yes. Oh my God, no, don't go any further, please. Oh.
Can you tilt your foot backwards in that position?
No, I can't.
If I get you to do that.
Oh my God, no, please.
Okay.
Oh.
So it's aggravating. I'm sorry, in every way.
Come and take a seat. You don't mind if Catherine sits in and watches, do you?
Yeah.
Yeah? You happy with that?
Yeah, fine.
Good. So you want me to jab you again, eh?
I do. I've been having terrible trouble.
Yeah. Where's most of the pain now?
It's actually it's down here, and it's pins, all fuzzy, pins and needles, and it's a pain.
Yeah. So don't forget, Tricia, like last time, it will probably hurt for a few more days afterwards. Okay.
Yeah.
Were you happy with that last time? Did it hurt much more, or?
No, just the same as the other
About
times.
the same.
Really.
Okay. And what about? And don't forget, I'm sticking a needle in you, so it can, you know, it's possible that it can cause infection or it can cause bleeding.
Yeah, that's.
You're happy to accept that?
Yeah,
risk,
I've already had it, so.
Yeah, you know what it's like.
I know more or less.
Okay, let's do this, shall we?
Hate it when it's.
It's not a nice thing. So, okay, let's pop this hand out here, just on there, up in that direction. Just a bit of cleaning, eh?
Yeah, my hand cream.
prick now. Well done. You're doing really well.
Oh, worse than ever. Oh, finish.
I think you've obviously got back pain, but there's some element of sciatica here going down the leg. But I think most of it is strain in the back.
Okay.
We need to try and relax the muscle there. I have got some concerns about you being able to drive in this position.
See, when I take the painkiller, I slowly can get into the car and get out of the car, you know?
It's the unpredictability of you maybe losing power in your right leg. So if you were operating, obviously, the brake and things, there is just a bit of risk there that you need to...
I need to consider,
As a taxi driver, you have a duty of care, so therefore, I would strongly urge you not to drive till your comfort is back and there's no pain. Yeah. My feeling is with the spasm in your back, you would benefit from something to relax the muscle.
Okay.
We don't often give this for every type of back pain, but with the spasm you've got, I think some diazepam could help you. So maybe, then, to keep things a bit simple, we'll give you cocodamol, but the stronger version, 30/500. You can take this diazepam to help relax the muscle. But with those medications, you're really not allowed to drive.
Okay, yeah, that's cool.
So don't take paracetamol on top of this cocodamol.
Thank you very much. Let me just get off the chair. Oh, oops. You see, that's the problem. I wish to be a little bit, like, quicker, you know, but it's just get these stages when my body is just say, stop there. Okay, here we go.
Hopefully things will loosen up and you can move. Okay.
Thank you very much. Have a good day.
Care.
Take care. Thank you.
Okay.
I try to do my best. Thank you.
All right.
Finish. Oh.
Hold on. All done. You've done really well.
That was worse than it's ever been.
That's probably because it's more tender than it's ever been as well, isn't it, eh?
Oh, that was bad.
Let's go.
See how much I've been suffering then? I feel like crying. It was that bad.
Yeah. Well, so it's a deep injection, though, isn't it? You know, it goes
I don't
deep
know.
into there.
I don't know. Well, just all I can say, I hope it works after all that.
Julie?
Yeah?
Have you been trying to call him Mr. Mohammed this afternoon? You tried him twice.
Did
somebody
I?
did. No, somebody did. But he missed the call because he was asleep.
Oh, well, they'll have to try again tomorrow.
He's gone. He's gone. Oh. He's gone.
But I put him on the list for tomorrow.
Lovely.
And I said, can you make sure he don't fall asleep?
Honestly, with your telephone on next to your head, so you...
Nice to see you.
Come on, Marcus.
Come right in. Yeah. We have Catherine here, who's a student from Southampton. Hello.
Nice to meet you.
How are you? Okay, right. So, Marcus, what can I do for Marcus?
So he's been in hospital.
Yeah.
But for cellulitis.
Yeah.
But he's been self-harming very badly this week, and I'm not sure. They've told me to come back to the doctor.
Yeah.
To be referred to something, but he's just...
Has he ever been to CAMS?
Yeah, he's on medication.
Yeah.
He's just so angry.
Is that right? Okay. So what other medication is he on in terms of, is he on anything from the ADHD point of view?
He's on Strattera.
Okay.
And he has melatonin at night.
Yeah, very good.
But this week he's got a massive barbecue fork and he's been trying to stab himself and
Has he done any damage at all?
I'm not too sure. Like, there's a couple of marks that have come
Just
up.
sit forward, Marcus, will we have a look? Yeah, just nearer me than that.
You need to sit like that with your head up, maybe. I think there's a little mark around there, but I got them off of him.
Yeah. Marcus, from the age of 2, had problems with attention span, problems with behaviour, and language as well. And it was eventually decided when he was old enough that he met the criteria for ADHD, attention deficit and hyperactivity disorder. ADHD manifests itself in 2 or 3 ways. So it can focus on hyperactivity, unproductive activity, disruptive activity, with sometimes a lack of focus, particularly on learning.
How are you feeling, Marcus?
No, not good.
Really? Not good in what way?
You need to tell the doctor.
What's school like? The school's lying about me.
Saying what?
Like, they say my mum was gonna batter me, but that was a lie. I never said that.
They said that she was going to do it, or they said you were saying she was going to do it?
He went into school last week and said I battered him. So obviously
I see.
they checked him all over.
Yeah.
But because he's lied about me, I took his iPad off of him and his Xbox.
Yeah.
I never lied.
So then we get this, the school's lying.
Yeah.
It's getting
difficult,
very severe at home with the self-harming.
Frustration is very common with ADHD. Self-harm is prevalent, but it doesn't affect everybody with ADHD.
It's a very difficult condition, and very difficult for Marcus to deal with.
Absolutely.
And very difficult for you to try and do your best as mum. It's difficult all round. But I think the amount of support is the key, I think. The amount of support, advice, and options and opportunities to give him, worthwhile distraction, so that he's doing something he likes and that actually gives him enjoyment.
In managing ADHD, you're trying all the time to minimize disruption. And one of the first ways of treating and managing ADHD is to improve the library of techniques. So the focus is very much around family therapy and parenting therapy. And one of the most useful techniques is getting the child to focus on something that they're interested in and that they're good at. And if they can find that one thing, then that's the way towards salvation, I think.
What made you take up golf?
I don't give up.
Good. And do you like it? Do you? Would you like to be a professional golfer when you grow up?
Yeah, I just want to be this guy. He's called Happy Gilmore.
Yeah.
Yeah, he can just batter it over about 5,000 meters.
That's a long way.
Very far.
4 miles. So how many times a week do you play golf?
2, no 1.
Once a week, usually, isn't it?
That's terrific. I'm really impressed. That's very good.
I'll go today.
You've got to go to school.
No, I'm not.
So I'll ring them up. But have you've got all their numbers, haven't you?
Yeah, I've rang the crisis team and everything. They've not contacted.
But have you rung this number in Upton, the 635645 number? Yeah. And what did they say to you?
They said they get a doctor to ring me back, but I've not heard anything.
Okay, I'll get on to them
Yeah, that was
today.
last week I rang them.
Yeah, I'll get on to them today.
I'm not going to a dumb school.
Marcus, you have to go to school now.
I'm not going to school!
Stop it.
Why do you not want to go to school, Marcus?
The dumb liars.
Right, well, maybe...
Well,
Still not. Starting to say it again.
Okay, well, maybe we'll just have a meeting with them and see what we can do, some work from home.
No, they're going to lie like they do.
Why don't I just get some work and we do it at home together? Yeah? Yeah? Is that better for today? Yeah? We'll do that then.
Mum, why do you believe in adults and not me?
it's very difficult.
Very.
Very difficult. I know it must seem so
Why do
unfair.
you not believe me? I tell the truth.
I do believe you, darling. All right then, what
Good,
do you
I'll
say?
get on to them. Yeah, it's nice to see you. Yes, just keep up with the golf, okay? Don't worry too much about school. Don't worry about anything else that upsets you. Just worry about the things that you can do really well in.
Yeah?
Okay? That's the key to being happy in life.
Okay.
Stay with what you're good at, and just get better and better and better at it.
Thank you very much.
Yeah,
Lovely
nice
to see you.
Yeah. All the best.
And to you. Thank you.
Bye.
Bye. Nice to meet you. Come on then. How can I help?
I've had my hip replaced, I've had my back replaced. I'm blind in my left eye.
Every part of my body was aching.
I'd like some hemorrhoid cream, please.
A couple of days later, the red eyes came.
I'm deaf in my left ear. I can't breathe out of my left nostril.
hernia's coming back again.
And all that pus.
Sickness, diarrhea,
Can I have some more of those antifungal tablets?
All my teeth fall now.
headaches, giddiness.
She also said to ask for some Imodium liquid.
I've been incontinent for a couple of years now.
For somebody with COPD, atrial fibrillation, multiple myeloma, hypertension, and carpal tunnel, you're doing pretty amazing.
Come and take your seat. Cheers. So you're not great at the moment, is that right?
No, they thought I had a bug about 3 months ago because I kept on coughing.
Yeah.
And they gave me antibiotics, inhalers, steroids, never worked for 3 months.
Yeah.
I said, yeah, because they thought it might be lung cancer.
Right.
Which had come back clear, so touch wood there wasn't that. Then they sent me up, because I'm out of breath from my stomach swollen. I've got mild heart failure.
Right, OK.
And I've been on water tablets now for about a month, but they've done nothing. My ankles are still swelling.
Yeah.
I'm still coughing in the morning, and my stomach's still bloated.
OK, let's have a look at those legs. OK, come and have a lie up here for me, Terry. I'm just going to put it down slightly. OK. So lying down doesn't make it any worse?
No, no.
OK, I'm going to listen to your back. Good. Interesting, your chest is really clear.
Yeah.
You do have some swelling there.
Yeah.
It may be that you've got some swelling in the belly as well.
Yeah.
OK, but it's difficult to tell. I mean, there seems to be a fluid level when I do this, but I think we need to get an ultrasound to try and work out whether that's the case or not.
Right, yeah.
OK. All right, so I've sent off that ultrasound. OK,
Right,
so
yep.
that's been, and they will contact you about that.
Yes.
OK. OK, that's all I'm going to do at the moment,
Okay.
mate. OK, so we need to get that ultrasound to have a look and see what's going on with the tummy. Okay?
Right, yep.
So we'll see from that. They'll tell us if there's any fluid there. If there's not, then we've got to think again about why you're feeling so big down below. OK. Yeah, I mean down here, it's not so bad. You know,
No,
I mean,
it's first thing in
there
the
is
morning, it's
something.
mainly my feet and that.
Yeah,
Tops
so
of my
it's
ankles.
not as bad as I would expect for that to be causing a problem in here. So that's why, and nothing on the chest.
Right, OK.
So that's why I'm not too worried that your heart's being that bad. So
Yeah.
which is why we need to do that.
OK, David. OK, thank you very much, David. Cheers,
Okay,
thank
mate.
you.
Russell said, what do you want for dinner? Which means he's cooking and he's also picking it up. It's because we had words last night. I was like, if I'm on a
You don't want to go out
late...
for a drink with your mum tonight, that's why.
Yeah, I was like, if I'm on a late, do not expect me to cook. Like, I can't cook anyway. Can you cook? Oh, God, must be just me.
Hello, it's Dr. Hyder. Come and have a seat. And how are you?
I've got a lump on my throat. I went to the other surgery and they just told me to come here today.
Yeah, you've had some antibiotics,
yeah,
haven't you?
I've got 3 left to take.
OK. Painful or not?
It was. It's not now.
And how long has it been there in total?
Since Thursday.
OK.
Yeah.
All right. So it was painful, now
Yeah.
it's not.
It's not as bad as it was.
Oh, yeah. Swallowing difficulty at all? Are you a smoker?
No.
Alcohol?
Now and again.
OK. It feels like it could be a salivary gland. Sorry, is that
Yeah,
tender when I'm pressing
a
it?
little bit.
So it's a bit tender as
Yeah.
well. Sometimes you get a swollen lymph node if you've had a viral infection. Have you had any illnesses at all?
No.
Sometimes it can be to do with your salivary gland, and a small stone can get blocked in there,
right,
causing the swelling.
Yeah.
But either way, we need to find out why. So we need to do a scan, an ultrasound scan, to have a look at it.
Right.
Does that sound reasonable to you?
Yeah.
And I'll just have a look at the back of your mouth as well. You just do a big and lift your tongue up if you can, like this. Yeah, that's fine. OK, that's fine. So usually if it's a salivary gland stone, people notice when they're chewing, it gets more painful and it can get bigger.
Oh, right.
But you haven't
Not
noticed
noticed,
that?
No. Nobody sort of said anything to me
Yeah.
about.
Yeah.
I just said suck on lemons and.
Yes, so that's right, actually.
Yeah.
So if you've got a stone in there and you suck on really sour things, it causes your salivary glands to produce more saliva and it can push the stone out. So that's the idea. I just want to feel what size it is. Just pop your chin down again. Just. Sorry to sort of prod around. What I'm going to do is I'm going to request the scan urgently.
Yeah.
if it all comes back as a salivary gland, that's reassuring. If it comes back as one lymph node, just one lymph node on its own, we sometimes refer those in for a biopsy. The reassuring thing is it's not likely to be something sinister if you're a non-smoker and you don't drink.
Yeah. I used to smoke.
When did you stop?
9 months ago.
OK, and how much did you used to smoke?
About 15 a day.
OK. That changes things a little bit in my mind, because what I don't want to happen is for you to be waiting ages for a scan and then something happens and it changes. So let's see how quickly they see the urgent ones if I press. OK. So if they're going to see you within 10 days, can I see you in 2 weeks?
Yeah.
So then at least we can look at the results and if it's still there, decide what to do.
OK.
If they say it looks completely fine, then that's great. If it's still there and they haven't really found out what it is, I think we'll be referring you on to a specialist.
Okay.
So can I see you on the Thursday, the 20th? I've got 5:20.
Yeah.
5:20. All right, so I'll see you then and you'll have your scan before then.
Yeah.
Take care then, bye-bye.
Alan Brown. Hi, Steph. Come and have a seat.
Your voice just popped off.
So I think I know what this is about. Come and have a seat. Can you get it back in all the way? Because I could partially reduce it.
I can get it all back.
Yeah.
But the moment that you let go of it,
it comes back out.
It comes back.
I think you need to have it done, to be honest. So I'm going to do that referral.
You know what happened, do you?
Yeah. So I remember you told me in the.
Well, they gave me the
anaesthetic.
Anaesthetic.
Yeah.
And apparently, everything went into meltdown sort of thing.
Okay.
The breathing, lungs went into spasms, and apparently I was in a bit of a tricky situation.
I'm on till 8 anyway, and I'm in at 8, so yes, I'm only going home for a couple of hours again.
I'm actually here to ask if I could get another sick note.
Will you tell them, please stop sending my patients upstairs?
Yeah.
They're still sending them. I've asked them about 6 times.
OK, she can get a job here, can't she?
I've got a full-time job at home with him.
Dr. Allen has asked if Nithi and Alicia can move their cars, please. Lovely, thank you.
Come on in and have a seat. So, we spoke on the phone, and I think you saw Dr. Kochar, didn't you?
I did.
A week or 2 ago? So, feeling very tired.
Yeah.
Is that right?
Yeah, I've since caught some stupid cold.
Right,
Which
OK.
I suppose I'd expect. Because what basically happened is trying to be a carer and work in Reading out of Slough, 30 miles there and back, and working in mental health NHS, it's sort of taken its toll.
It all got a bit much, did it?
Yeah, I can't physically or mentally do it anymore because I'm
Right.
finding it's more the physical part, and because I work in mental health, I'm very aware of like stop, because it can get edgy.
What do you mean edgy?
Edgy, it's like you think, oh, I can't even think about all this anymore because it makes you ill.
Sue is a lady who I've looked after for many years. She's always worked in the caring professions and in mental health, and she has had some work-related stress in the past. Most recently, she's been seeing us with concerns around the fact that she's the sole carer for her 91-year-old aunt who lives with her.
So, are you getting enough help, Susan, with her?
No, at the moment we've got no one. Got a very good social worker locally, and she's going to help us to get new carers quite soon.
Have you spoken to work about the situation?
Yeah, that's been ongoing. I work for
How
the
long
NHS.
I mean, how long have you been mentioning it at work?
Oh, over the last few years, I guess.
There's good evidence that carers are more at risk of stress and anxiety and depression. This is obviously because caring for someone can be a stressful experience. Carers often feel guilty about the fact that they're more mobile, more fit and healthy than the person they're looking after for. There can sometimes be a sense of entrapment, and there's often a financial implication as well. So, Dr. Kershaw did a lot of bloods. They've all come back as fine, which is good. So
I'm amazed at that. I thought I might have had a bit of a...
What did you think
I must
about
be
that?
very healthy, bloody wise.
I don't know that you're very healthy, but...
Well, it's because I'm a worn-out person.
I suppose what I'm saying is that there wasn't anything we picked up in the bloods. So, how do we move this forward, Susan?
I just feel I need a bit more time off, to be honest, because I need to get... Well, firstly, because my body's not quite ready. I still do get a bit tired, but I think that's because I went and got this cold as well.
So I need to extend your certificate that he gave
Well,
you,
that would
yeah?
be helpful because of
Okay.
the fact of I just need my body to pick up a bit more.
Couple more weeks?
Yeah, would help.
Okay. The certificate runs out when, Susan?
Oh, I think it ran out yesterday.
Okay. You don't need to talk to anyone about all of this stress, talking therapies?
No, I've left that because the simple reason is, although there's a lot going on and a lot happening, I think that because I'm very aware of mental health, things do iron themselves out.
Okay.
And it's time that normally does it, and I think it actually helps me, the fact that I've worked in acute mental health.
Because it makes you more aware of
the
issues.
when you become edgy and you think don't think like that. Do you know what I mean? And what I mean by that is like, don't think about you might become ill in that manner, because you don't need to. So you can empower yourself, your own mind, you know.
You've beautifully identified the things that are causing you the issues, aren't they? We've ruled out anything physical that could be exacerbating everything. Which is of course good. So it's now dealing with that, isn't it? So you're seeing occupational health this morning?
Yeah, I'm going to see them about 2:00, and they're very nice as well.
Excellent.
Yeah, I just think the government, if it woke up a bit and allowed me to, you know, sort of like, there's thousands of women. It's women at the moment.
I know.
Well, it's nice seeing you again.
Yes, long time no see.
And you're a brilliant doctor, I have to say, and always will be.
You take care of yourself, Susan, OK?
I will.
Bye-bye.
Thanks for seeing me.
No problem. Bye-bye.
I don't really know what happened.
Okay.
And then I got a copy letter that said that the heart and something else was normal.
Yeah.
Which is something else that they brought up.
Okay.
Lungs were clear. So I don't really know what the next step is. That was all. I just wanted to come and have a quick chat with you to see what the next course of action was.
What I've got is, what this basically said is that you went into bronchospasm with high airway pressure. It was difficult to continue with general anaesthetic, wheezy and not safe to proceed. Dr. O'Connor treated with adrenaline hydrocortisone. Yeah, okay, so pretty serious, wasn't it? So did you see anybody afterwards?
Yeah, I saw
a chest consultant.
A chest man, a heart man.
Yeah, and what did they say to you?
Nothing really.
The steps are, you need to be seen from the chest point of view to figure out what your risk is for doing this again, and whether then an anaesthetist to decide with that information, do they do an epidural, do they try and do it again, do they use a different anaesthetic agent, that sort of stuff. So there's 2 steps before you get to the surgeons.
Sure.
Once that's all been sorted out, then you go to the surgeons. Now the thing about this is, it would be better to have those 2 steps done in the same hospital where you intend to have the surgery, because at least they're all in the same departments, can talk to each other easily, and letters can be seen on the same system.
Gotcha. Yeah.
What's the reason behind why it's been left so long then?
It just went on.
But what I'm saying is, between 2011 and when I saw you, it was the fear, wasn't it, that was keeping you away?
Yeah, I think it probably was, yeah.
So the question, so what I'm trying to say is, I want to know that you're actually going to be okay once you get in the front door. I don't want you to then sort of think, oh, I'm not doing this again, because that's what happened last time, isn't it? I sort of referred you and then you didn't go, I think.
I didn't do anything. That was me being absolutely lazy. Okay. So I mean, yes, let's do that. It's on your head though.
Thanks.
No, let's do that.
So I'm going to write 1 letter that I'm going to copy into all those 3 specialties. In the meantime, do you remember I told you, if this gets to the stage where you can't push it back in at all, or it starts becoming really painful, or starts turning a different colour, that sort of thing, then you need to see us on the same day, because that would be an emergency admission. Then.
You know, I'm all okay with that at the moment.
Yeah. OK, so I'll get the ball rolling. If you don't hear from anyone in the next 6 weeks, you need to let us know, just in case something's gone wrong in the referral chain.
Yeah.
Yeah? OK, good. Take care.
And you.
Take care, okay?
Yeah, stay
See
well.
you. Yeah, you too. Bye.
You're asking the person that's been here longer than you to make you a copy. That doesn't work here. Newbies always make the
Are you
coffee.
going to get the phone then?
Get the phone and then make the coffee out.
What's it? Fan and road cancellation line, Kerry speaking.
That's it?
Why
you do that?
Come out that way. Fan and road, Kerry speaking, cancellation line.
Denise Morgan. Hello.
Good morning.
Dr. Rice was seat.
Oh dear. I came here a couple of months ago. I suffer with plantar fasciitis. I went and see the podiatrist. She gave me some exercises, but I find just a couple of days, the pain is unbearable. I'm on my feet all day long, and now it's hurting me even when I'm in bed.
Mm-hmm. And how long have you had it for?
Since February, actually.
Okay, can we have a look? Which foot's it in?
This one.
This one. That's right. I can't help noticing that your shoes, you haven't got any insole or support in here.
They haven't given me anything yet. I have to wear something with a raised heel.
Right, okay.
Or else it's just impossible.
Because what's causing it is what's plantar fasciitis is that you have the arch of your foot here. It's like the arch collapsing. And what the best treatment is to go and buy an insole or to get some shoes that support this part of the foot. But it's caused by footwear. So these shoes here, you see, they're quite flat. There's no difference across here. You need to have something here to support it. And if it's flat like this, having an insole that just has a little bit of arch support, that's what you need. Because what happens, the foot's quite complex, as you know. So these are the bones of the foot which form an arch. And this one here is connected to the heel bone by something called the plantar fascia.
Yeah.
And then it pulls it in.
Yeah.
And what happens, if you don't support this, the weight of the foot starts to push down on it, and that stretches this, and that causes the pain here on the heel where you're getting it. This is the plantar fascia, so plantar fasciitis means inflammation here at that point. And the arch takes all the weight off the plantar fascia, so the arch support. So that's, in my view, that nearly always works. The other options are physiotherapy sometimes helps, painkillers, and I've once given someone an injection. How are you hoping they could help today?
Anything that would take the pain away, because it really make me a bit disabled.
I'm sure, yes. Are you able to go to work?
I can tolerate pain, but this one just sort of, and it's a bit embarrassing as well when I'm looking after patients and hobbling around. But it won't stop me from going to work. Okay. It has to be really at the point of. But I don't know what to do, to be quite honest.
Okay, that's, as I said, that's my advice. That nearly always works.
Get some insoles and see how it. If not,
then okay, I hope that helps. It usually, as I say, it usually does.
Yes.
Yeah. It's very painful. I understand how difficult it can be. Yeah. Okay. Okay. Let me get the door for you. Okay. Okay. Bye bye.
Thank you. Bye bye.
Adam.
Hi, Ed. I'm good. Come and go see. Thank you for waiting, Adam.
That's all right.
How can I help today?
Basically, I come here, I think, like a month ago. They gave me some antidepressants.
Okay.
Since then, I've took them, like, basically, I stopped eating, things like that. I don't know, they affected me in a way where it's like, I don't know, I don't find them helpful.
Okay, how's your mood been since you started the medication?
Basically, I've spiraled out of control, yeah. Basically, pushing everyone away for that supporting me, and like my sleep patterns no good. I've turned to drugs.
Adam, I'm glad you came in today, buddy, okay? Because there's lots of things that we can do to help. And it's good that instead of letting it continue to spiral out of control, you've come in to see us so that we can work on the next steps, okay? There's a couple of things I wanted to ask. How long have you been feeling down for?
Months, man, months.
Is there anything in particular that's making you feel down?
Do you know what it is? It's like lack of sleep, my eating. It's like, you know, all them little things are affecting me. Then I'm at home and, you know, got kids and, you know, my missus, and when we have a little argument, the way I deal, my coping mechanism, to deal with problems is to basically go to drugs.
Okay, and which drugs are you using at the moment?
Like probably £30 to £20 a day.
Which ones?
Prep.
Can I have your son's date of birth?
The number one thing, of course, is we need to get you feeling better. We need to improve your mood. But coming off the drugs is an essential part of that whole process, okay? There's a very, very good team in Slough called Turning Point. Have you heard of Turning Point?
No, I've worked with... Do you know, it is if you want to stop, you'll stop. Basically, I'm using the drug as an upper because when I'm so shitty and so down, I'm using it to bring myself out of what I'm feeling. Do you know what I mean? Eating, I'll probably eat a decent meal a day.
Yeah.
And then when I smoke, I sick it up.
Okay.
I make myself smoke that much till I'm sick. Do you know what I mean? It's like, and I'm not happy. I'm not happy with smoking.
Adam?
I've been to probation.
I'm just going to slow you down a second, okay? Because I want to make sure that we get all these important points talked about, okay? So you mentioned about the sleep, that you wake up 8 to 9 times a night. Are you thinking about a lot of things when you wake up?
Yeah, probably. That's why I'm stressed.
I have to ask this, a really important question. Have you had any thoughts about hurting yourself or harming yourself?
Yeah, basically I have, yeah.
And what thoughts have you had?
I like cut my wrists and things like that.
Were you thinking about it or you've done it?
No, I just done it. Basically, I just cut myself and that, innit? Like little minor things, nothing like. It's my own little mercy. Do you know what I mean? It's my like. Do you know what I mean? It's nothing.
The other side as well?
No, not the other side. But do you know what I mean? It's just
Adam, did you regret what you did?
Yeah, I regret everything because this isn't me. I'm not an addict. I'm not. Do you know what I mean? This is the way I deal with my problems. I don't want to go out and hurt no one else, but my actions are affecting my family, like my kids and my whereabouts, where I am, what I'm doing.
Adam, I have to ask, so you did that a couple of weeks ago.
Yeah.
Since then, have you had any thoughts about hurting yourself or harming yourself?
Just to tell the truth, it's sad. It's sad the way I'm living. Do you know what I mean? Even my clothes are disowning me. It's like nothing seems to fit me.
Adam?
I've lost so much weight.
Adam, so is there anything that would stop you from hurting yourself or harming yourself? Thoughts about your children?
Yeah, that's the only positive I have in my life. Do you know what I mean? Without them, I don't know where I'd be. I'd probably be locked up.
We need to help get you better, okay? You mentioned about the medication. Now, the difficulty is the symptoms that you're mentioning are in keeping with clinical depression. So the fact that you're not eating and you're not sleeping, I don't think it's part of the medication. I think that's all part of how you're feeling. Does that make sense?
I'm losing like so much.
Are you happy to try a different medication?
Yeah, but I just think that there ain't nothing. I need something to gain weight. I need to put get my health back.
Absolutely. Adam, we're going to go.
At the moment, I'm just taking pills after pills and smoking tobacco and.
Okay, Adam,
do you know what I mean?
Here's what I want you to do. Okay, I'm going to explain to you exactly what we're going to do. I'm going to explain everything, and then we'll go through it. Okay. Number one, I'm going to refer you to our psychiatric service. Okay. Number two, medication is very, very effective in patients who are suffering with depression and anxiety and anger issues, okay? The third thing is the drugs. We need to get you off these drugs, okay? The illicit drugs is an absolute no-no, and it will make your situation far worse. You know, you're spending all this money a day, it's going to be affecting your mood, it's going to be affecting your physical health. And, you know, it's a dangerous drug, crack cocaine, which is why it's a Class A drug.
Is there any chance I can get something to help me sleep? Because that's my main thing, because when I'm not sleeping,
Adam?
I'm going out.
Absolutely. So, let me do that. Have you heard of the crisis team?
No.
Okay. The crisis team is a team that's there that if you feel your mood's deteriorating and you're feeling like you want to hurt yourself or harm yourself, call this number. Let me give you the medication. Let me book you a follow-up appointment. So in 2 weeks' time, on Monday the 3rd, so I'm booking you in right now, okay? Before this appointment, Adam, you will have taken 2 weeks of this medication, which is essentially the antidepressant medication. This, I'm going to give you some sleeping tablets to help you. You should have been contacted by the mental health team, okay? And I want you to have contacted Turning Point. Let's get this sorted. All right, Adam? It was lovely to see you. I'll see you in 2 weeks' time then. No trouble.
help you today?
Well, I take morphine, but I'm in a lot of pain. It's my hip.
Okay, so how long have you had this pain for?
Only about 2 days.
2 days.
Yeah.
How did it start?
Well, it just stayed. I mean,
Were you doing anything at the time, or was it when you woke up in the morning?
I had been in the garden, but I don't do anything exciting in the garden, you know what I mean? Because I can't lift things and things.
Yeah.
So
What were you doing in the garden then?
I just potter.
Yeah. Had you been bending on the ground?
I have bent down, yeah. So you have to kneel to get to a flower bed, don't you?
Yeah. Is it okay if I examine your hip?
Yeah, yeah.
Yeah. Do you think that you'd be able to lie down on here if I change? Do you mind taking the trousers off, actually? It'll be a bit easier.
That's really hurting me now.
Yeah. What are these old scars from?
Burns.
How long ago was that?
When I was 13.
What happened?
Fireworks.
Oh, my goodness.
Fireworks in your pockets.
And they went off?
Yeah. Took skin off there to put on there. Because there was no skin on this side.
Oh, so this is not a burn on this side?
No, that's not a burn,
from
that's
a graft.
skin graft. We're talking 40 years ago.
Can I get you to bend this knee, if that's all right? That's okay.
It feels okay.
I'm going to gently do this side.
Yeah.
Pain?
Yeah,
Right now, what about
starting to.
that?
Yeah, when
Yeah,
you move
sorry,
it that
I'm so
way.
sorry.
See, the pain I find is just about there.
Okay, I'll let you get dressed. Just be careful and steps just here if you need it getting off.
See, I can hardly get up, you see. Normally I can get up and things, but I can't now.
Do you need a hand or are you okay?
No, I'm fine, love. Thank you for the offer.
So when you're going to the toilet, any problems passing urine or opening your bowels? Have you got full control over that?
Yeah,
Yeah?
it's fine.
And any numbness, weakness or tingling of your legs since you've had the hip pain?
No, I haven't noticed it since then.
Okay, all right. I think what we should do is get an X-ray
Yeah.
of your hip to check that there's no joint problem with your hip.
Mm.
But can I also get you to see me in about 1 to 2 weeks' time to see how you're getting on?
Yeah.
If things get worse in the meantime...
No, I will do. I'll come back. Don't worry.
But in particular, numbness, weakness and tingling of both of your legs, or you've lost control of your bowels or bladder, can you make sure that you see us straight away?
I will do.
Yeah?
I will do.
OK. If you're in a lot of pain with the hip, you can take a little bit of the Oromorph to top it up if you need to. You know about that as well. I can see you on the 19th.
Yeah, no, that'll be fine, anytime.
And hopefully we'll have the result back by then of your X-ray.
That's fine. Thank you, Doctor.
All right, see you soon. Take care. Bye.
Have a nice day.
Bye.